Hello, Assalamu alaikum. Thank you very much for the introduction, and I'm happy to be with you today to speak about the MiniMed 780G automated insulin delivery system and how it adapts to the substantial changes in daily routine. So, during these 15 minutes, I'll be focusing on the MiniMed 780G system adaptation to the fasting experience during the month of Ramadan. So these are my disclosures, and this session is sponsored by Medtronic. So fasting during the month of Ramadan is mandatory for all healthy adult Muslims who do not have a reason to be exempt from fasting. Ramadan is a month that you all know when significant changes take place in lifestyle, behaviors, physiology, and as well as treatment of people with diabetes. And especially for people with type 1 diabetes, fasting during the month of Ramadan can be very challenging. So we wanted to take a look at the data of the 780G system users in the real-world setting in 7 Gulf countries during the month of Ramadan. And we compared those data from before Ramadan, during Ramadan, and after Ramadan to see what happens to glucose readings, insulin doses among the 780G system users as they transition from Sha'ban pre-Ramadan to Ramadan, and then as they transition out of Ramadan to the month of Shawwal. So we've had over 440 individuals with type 1 diabetes who used the 780G system during the month of Ramadan. And you could see here the patient's characteristics. So approximately 55% were younger than the age of 15, and 45% of those individuals were older than the age of 15. And you could see the data. So these 3 columns before, during, and after Ramadan, you could see the sensor glucose. The average sensor glucose was 150 before Ramadan, 152 during Ramadan, and 152 during or after Ramadan. And you could see the rest of the data. So if you'd look at the proportion of patients with time in range greater than 70%, you see that it's 56% before Ramadan, and then it became 53% of users with time in range above 70 during Ramadan, and then it went back to or it went down to 52.6 after Ramadan. So I think the more interesting data are shown on this slide. And this might be a busy slide, so I'm going to take you through the slide one by one. So at first, I want you to focus on the overall glucose or CGM metrics. So the left of the slide is before Ramadan, the middle of the slide is during Ramadan, and to the right of the slide is after Ramadan CGM data. And I highlighted the overall CGM data for each timeline. So overall meaning day and night CGM data. And what you could appreciate is the fact that time in ranges, whether it's time in range, time below range, or time above range, remain pretty much the same during Ramadan compared to before Ramadan and after Ramadan. What did change in these individuals is the distribution of time in range between, or time in ranges between daytime and nighttime. So during Ramadan, daytime, you could see the best time in range. So the highest time in range, almost 80% time in range. Whereas before Ramadan, daytime time in range was 74, and post-Ramadan, daytime time in range was 73. And then when you, and also it might be important to highlight that time below range during the daytime of Ramadan remained essentially the same as it was before Ramadan and as it went after Ramadan. So really no increase in time below range during the daytime of Ramadan. However, time in range improved. Let's now look at the nighttime time and ranges. And what you see here is the fact that time above range increased remarkably during the nighttime of Ramadan compared to the nighttime before Ramadan, compared to the nighttime after Ramadan. And this increase in time above range during the nighttime of Ramadan was at the expense of time in range. So to summarize, overall, time in ranges remain stable before, during, and after Ramadan. However, during the daytime, time in range is the best during Ramadan when these people are fasting, and time below range does not change or does not increase during the daytime fasting in Ramadan. During the nighttime, however, time above range increases during Ramadan compared to the other times or the other months. And when you look down, you could see, if you focus on the bottom middle figure, you could see that most of the hyperglycemia or most of the time above range that happens during Ramadan is post-iftar. That is clearly shown on this slide. So what about insulin doses? So same story. If you focus on the overall data, you could see that the total daily dose of insulin is comparable before, during, and after Ramadan. What changes, however, is the distribution of basal to bolus between daytime and nighttime during Ramadan. So what do I mean by this? So if you look at the daytime of Ramadan in the middle of this slide, you see that most of the insulin that the pump is delivering during the daytime of Ramadan when these people are fasting is in the form of basal insulin. So boluses are minimal, which makes sense. So these are people who are not eating during the daytime because they are fasting. However, when you look at the nighttime, you see the opposite. Most of the total daily dose of insulin that's being delivered by the pump is delivered in the form of manual boluses, which is boluses for meals, whereas the basal insulin is less. And if you focus on the 4.3%, 4.3 units of autocorrection during the nighttime, and you compare it to the 2.7 autocorrection during the daytime of Ramadan, you could see that the hyperglycemia that happens post-iftar triggers some additional autocorrections overnight compared to the daytime. So clearly, the pump is trying to adapt to the changes that happen between daytime and nighttime during Ramadan to maintain glucose control within target, as we've seen in the previous slide. So what about when you look at the age or the time and ranges by age group? Again, you could see the same picture. So overall, glucose control is reasonable during Ramadan. Daytime glucose control is even better with no increased risk of hypoglycemia. People tend to struggle with time above range and post-iftar hyperglycemia, especially kids who are younger than age of 15, and also those who are older than 15. They have time above range during the nighttime of Ramadan that is above target. So what about users of the 780G system who optimize their pump settings? So these tend to do better. So users with glucose target of 100 compared to users with glucose target above 100, so 110 or 120. Those with glucose target of 100 have the best time and range, whether it's daytime or nighttime, if you compare it to time in range in those with glucose target settings above 100. What about the optimal setting of both glucose target 100 and active insulin time of 2 hours? 2 hours, this is associated with even better time in ranges. So better time in range, better time above range, better time below range. And more importantly, during the daytime, during fasting, with these optimal settings, the time in range or the average time in range of this individual was 87%, with no significant increase in time below range. So it is clear that the optimal setting of glucose target of 100 and active insulin time of 2 hours during the month of Ramadan seems to be suitable and best for most people with type 1 diabetes who are using the 780G system. So what about the again, those on the optimal setting? If you want to see the percentage of people who achieve time in range above 70 during Ramadan, you could see that 88% of them achieved this target, and 83% achieved the target of time below range of less than 4%. So we've also done algorithm adaptation analysis to see what happens in glucose control as these patients move from the month of Sha'ban before Ramadan into the month of Ramadan, and then out of Ramadan into the month of Shawwal. And these are the data. So essentially, when you look at these time and ranges, I would not think that anyone would be able to pick which day did Ramadan or on which day did Ramadan start based on these time and ranges, and on which day did Ramadan end based on these readings. But to make it easier for everyone, we labeled those days. So here you could see the first day before Ramadan and the first 7 days of Ramadan to the right side, the last 7 days of Sha'ban on the left side, and essentially you see comparable time and ranges, time above range and time below range. The same is true as these patients transition from Ramadan to Shawwal. So essentially stable glucose control before, during, and after Ramadan. So to conclude, Ramadan is a period of challenging glycemic control, especially for people with type 1 diabetes. And the use of automated insulin delivery systems, such as the MiniMed 780G system, provided safe and effective therapy in people with type 1 diabetes during Ramadan. And the adaptation of the algorithm during the month of Ramadan was rapid, as you've seen. So it doesn't take more than a day or so for the system to adapt, and essentially the glucose control remains stable as these individuals go into Ramadan and out of Ramadan. And lessons from the use of the MiniMed 780G system during the month of Ramadan can be implemented for those experiencing transitions such as sick days or intermittent fasting for religious or non-religious reasons and other situations. So with this, I conclude my talk, and I hope you found it educational, and happy Ramadan. Thank you.